Welcome to Social Work Sunday Tea. I am Shakia Houston. It's a great day to be alive and well. It is July 17th, 2022. Make sure you like, subscribe, make sure you share. We're gonna have an awesome discussion and great information that'll help somebody to help somebody else. So we have a special guest here. Miss Turner, if you'd like to introduce yourself, greatly appreciate it.
Sure, Shakia. Thank you for having me. Yes, my name is Crystal Turner, and I come on here. I am a psychiatric nurse practitioner. I've worked as a registered nurse for roughly 23 years. A large portion of that I've done in psychiatry. For the past going on 5 years, I've worked as in advanced practice nursing in the area of psychiatry, and so I currently work in community health. Um, in communities of color, primarily working with African American people, but other people as well to address their mental health issues that they're having. And so I see a lot of what is common in our communities currently.
Okay. What made you? Thank you so much for serving and being a vessel as far as helping. I'm really that. I mean, listen, it's amazing to see women of color to be in this arena and be able to um, meet the needs. So, what made you get into um, psychiatric as a psychiatric or a nurse practitioner? What made you get into this?
Well, I will say that I first became familiar with psychiatry. I first became familiar with psychiatry because my mom, as a child, my mom was a psychiatric nurse. She worked on the south side of Chicago. A large portion of her time was at Jackson Park Hospital.
Okay.
And so seeing how my mom, because oftentimes when we were out in the community, she would see patients that she had. And the way that I think what caught my attention first when it came to mental health is her way of approaching in a graceful way people who she saw maybe in the hospital setting, now in the community, who would frequently approach her. Maybe they approached her, maybe not in the most stable state, but
Yeah.
just to see how she gracefully approached them. And I recognized through her that there was a skill that you had or that she had when it came to dealing with people or connecting with people who were dealing with any kind of mental health issues. That was what first caught my interest. My mom worked in psychiatry for a long time, but we also have people in our family. My grandmother, her mother, one of them, who dealt with mental illness throughout their life, and particularly with my grandmother. That would have been in a time when mental health really wasn't accepted. It was, we have stigma now, but it was at a whole nother level when my grandmother was younger, and the things that she ended up having to go through. A lot of institutionalization was going on back then, and
Hmm.
so the disparities that were there were very high. And so these were the two things that really caught my attention and naturally caught my interest. In all honesty, as a teenager, we're difficult oftentimes with our parents. And I was one who was, my mom couldn't say much to me. But I remember one night when she opened up to me about her mother's mental illness, we literally sat on the couch that night and talked for like 3 hours because it was so much to the mental health piece that really spoke to me, really spoke to me.
Yeah. Yeah. Oh wow, that's amazing. And it takes a special individual. It takes special people um, take care of people that have mental illnesses. It's a whole
I
different ball.
agree. I
And
agree.
yeah, like you got everybody is not made for that. You know,
Right.
you just don't have it because you don't really have the capacity to be able to handle that because it can be too much. It can be
Mhm.
too
Mhm. Mhm.
much. And so and so yeah, like I was telling you before the live, like I love what you just shared because I kind of like connected that way. But growing up, you thought that people that have mental illnesses, oh, they crazy. Oh no, no,
Mhm. Mhm. Or they're to be feared,
Wow.
or they're dangerous. Yeah. Yeah.
Yes,
Very
absolutely. So
true.
like when I got into this field, I was just like, oh, they no different than me. I'm like 1 second away from having a chemical imbalance.
Mhm.
Like
Mhm.
1 second, let something traumatic happen. Oh, it's over. You know what I mean? Like I put myself in, working with people with mental illnesses. I put myself in their shoes,
Yeah.
and I connect with them, and it's just amazing and it's beautiful at the same time, because when people write them off or when people like, I don't want to deal with it when the family and here I come.
Mhm.
Hey, what we
Mhm. Mhm.
doing? Come
Right.
here. Hug. You okay? You ain't come on, let's take a shower and give them that support, and I love, 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 love doing that. And even people that's out on the street, I know I got that gift. And when I'm out
Mhm.
on the street, my daughter say, "Is this your patient?" I mean, they just walk up to me and be like, and they start, speaking in third person. I was like, okay, what is it that you need? So what we doing? And they be like, okay, okay. And I was like, well, I'm gonna point you to the direction that you need. And my daughter think everybody my patient. I was like, I don't even know 'em. So you gotta have that touch. I
But you
don't
know
know 'em
what?
out of
I
nowhere. They just come. And I'm like,
I
okay,
sense
okay,
that.
God.
I could sense that.
Yeah.
I can sense that from you, and
Definitely.
it's interesting because when you say that it takes a special person, I think that what you're speaking about and what you said, that empathy piece is a big part of being able to really engage because you, like you said, being able to put yourself in someone else's shoes, I think oftentimes allows you to have more patience in things where some people were just like, oh no, they said this, they said that, they were, they approached me in this way. And while
Yeah.
yes, we do, it's important to have boundaries and show even people with mental illness that they have the capacity to have their boundaries, but it just allows to be able to have more patience and understand they're in this moment, you know,
Yep.
and I want to support them through the moment.
Absolutely. And I'll be like, okay, now I'm gonna give you what you need, but what you gonna do with it after I give you what you need?
I
So
love that.
because they need that support because they feel, it's so much going on that's transpiring in their heads, internal
Mhm.
stimulation,
Mhm. Mhm.
hallucinations,
Mhm. Mhm.
audio and visual hallucination. I mean, I get excited talking about it because I love it and I love helping people in that capacity. And
It's beautiful.
listen, it's a beautiful thing, and because like it's not for the faint of heart. Because when I first started, I was like, I ain't gonna be able to do this ain't gonna. But
Well,
then
I've had
over
plenty.
time, but
No,
over
I've had
time,
plenty of friends who do that. They're like, "How can you do this work? How can you do it?" And I'm like, that's the key thing to let if you can do it or you can. When you're asking me how I can do it, then I'm telling you, it's a different, you know, kind of like with teachers. It takes a special person with teachers
yes,
to deal with children as well. I hear that.
yes,
I hear that.
absolutely, yes, absolutely. So today's topic, we're talking about psychotropic medications. Can you give everybody like what are psychotropic medications and what
So
are
it's a
you
gen.
there? Yes.
Yeah, it's a generalized term for all psychiatric medications that are used, and there are different, but it breaks down. So that's kind of like I would say an umbrella term for all of the different types of medications that are used to approach mental health or mental illness that people might be dealing with. But so in psychotropic medications, we have different types of medications like antipsychotics,
Yeah.
antipsychotic medications. We have our anti-anxiety medications, our antidepressants, um, anti-panic, and stimulants are also in there for people who are maybe dealing with ADHD. We also talk about stimulants. So it's really an umbrella term to really categorize that there are all of these different types of medications to treat different types of mental illness that are going on.
Yeah, absolutely. So how do people, okay, we have this mental illness, we have this diagnosis. How do
Hmm.
we subscribe um how do we subscribe medications? Is it based off the diagnosis or what? How do
Definitely. Okay, so there's a big part that, so once I have assessed someone, and I realize that they're dealing with a particular diagnosis, because that it is that diagnosis that comes first, and really recognizing what that is that they're experiencing, then I look at the different categories of psychotropic medications. For example, somebody who's dealing with trauma versus someone who has schizophrenia. When you take that history from them, you can really kind of, based on that history and how they're presenting, determine what's really going on. Because someone can have trauma and be talking to themselves, and a person just says they have schizophrenia. But when you get that history, you get more clarity. And then from there, if someone has schizophrenia, for example, then I would be looking at the antipsychotic medications. But if someone's dealing with maybe trauma, for example, then it's a different class of medications. Oftentimes, certain medications in the antidepressant realm are more effective for people who are dealing with trauma, who are dealing with different symptoms.
Absolutely. So, like some of the medications, working in psych, we know about the Ativan, we know about the
Hmm.
Haldol, and
Hmm.
everybody like, oh, Ativan and Haldol. I was like, okay, so can you explain some of the medications? And I know what I'm like. I know like what it how it helps people more
Hmm.
than harm
Hmm.
people. If
Hmm.
you can explain like as far as like the different medications for like Ativan and Haldol, like, what is it used for?
Okay, sure. So Ativan and Haldol are in two different drug classes, but the reason you may hear those often is because they're both very commonly used as emergency medications when a person's
Absolutely.
in the hospital or maybe in a nursing home setting. They'll have those medications where they can be injected. Both those medications can be taken orally, but they also can be injected. And oftentimes, when people are in hospital settings or controlled settings, they will have, because oftentimes when people are in controlled settings, not necessarily in nursing homes, but in the hospital, people are in a more acute state with
Right.
their symptoms, and so it's often that there will be the emergency form of the medication, meaning the injectable form. It works faster if someone's really having some distress, or in a state where they cannot be talked down, or
Yeah.
their symptoms cannot be managed through talking to them. So then medications like Haldol and Ativan are used. But there are two different drug classes. So Haldol is one of the common medications, and also maybe one of the more old school medications used to treat different types of
Yeah.
psychosis as it presents. And then Ativan is a benzodiazepine, a controlled substance that's under the category of anxiety. So those two are commonly used together because when oftentimes if people are having acute moments in, if they're having psychosis, for example, they're anxious and they're wound up, but then they're also maybe responding to internal stimuli or delusional or having different psychotic symptoms too. That so oftentimes both of those medications may be used to help mitigate that in an emergency situation. But if I were to talk more about different classes of medication, if we go back to Haldol, as I mentioned, Haldol is an antipsychotic. So there are two different classes of medications under antipsychotics. There are
Okay.
typical. Haldol comes out of the category of typical antipsychotics, and they are the more old school antipsychotics. And then
Mm.
there's a group of medications under that same umbrella called atypical antipsychotics, and those are our newer medications. And so, what makes the difference between the two classes is that the older, more old school, where Haldol lies, um, the
Mhm.
thing is, neither one is thought to treat the symptoms better, be it typical or atypical. They are thought to really address the actual symptoms the same. But the typical antipsychotics have tended to have more side effects with like EPS, like extrapyramidal movements. With some of these
Hmm.
medications, people have the uncontrolled movements,
Yeah.
depending on dosing and things like that. And there's more of that seen in the typical antipsychotics. It can
Okay.
still be in the typical antipsychotics, but it's more common in the others. Now, with the atypical antipsychotics are newer medications. It's been thought that they have less of that. But just to keep in mind, there's still issues that we find with some of the medications in our newer drug classes where they may have more of the metabolic side effects. Where they'll be at more at risk for diabetes, more at risk for hypertension or high cholesterol. So both areas there has to be monitoring just to make sure on how people respond because everyone responds differently.
Absolutely. You just, yes, I love it. And you know what? When I first started, working in long-term care, everybody was like, "Oh, yes," as a PRN, as you say, for
Mhm.
how, especially if they have behaviors, as far
Mhm.
as hallucinations, delusions.
Mhm.
I had a client where she was like, "I see graveyards and dead people," and when I first heard it, I was like, you see
Yeah.
what? Like it just wasn't real to me, and
Mhm.
but
Mhm.
but they gave her medication, and over the period of time, it kind of like she get back on her baseline. She wasn't like when
Mhm.
like our
Mhm.
cycling, just being observant. And I work with the nurse practitioner and the psychiatrist and things like that. And I'll be like,
Mhm.
hey, when they come in the building, like, hey, such and such is spiraling, and
Mhm.
yeah, something they cooking up. So is it something, maybe you need to do a medication review. And
Yeah.
they love it because I'm observant. Like I know when, because I know my patients, and that's the
Yeah.
beauty of it. I know them like front and back. Like what? It's a change. They doing
Yeah.
this,
Yeah.
and
Yeah.
I know when it's time for, like, especially like the monthly injections. When
Mhm.
it's about to wear out of their system, I be
Mhm.
like, oh,
Mhm.
I think
You
it's
can
about that
see for
time.
some people.
They
Mhm.
start doing the
Mhm.
same thing when they first, like when I first get them. I kind of do a 14-day observation just to see, okay, what do I have without
Mhm.
the medication,
Mhm.
or getting the medication, or and you know, it's percolating. I like to say percolating. It's percolating, in
Percolating.
their system. And then I can see over time, oh, okay, that does keeps them on their baseline, have normal conversations, um, be able to articulate. They also tell you how the medication makes them feel.
Yes.
And so I know about the side effects. Like, what about an antidepressant? I'm
Mhm.
trying to think of one. Um, as far as what the side effects, because everything have a side effects. Because I know some people, they have been diagnosed with depression, right?
Mhm.
Um,
Mhm.
Depression and anxiety, but they don't
Mhm.
want to take the medication.
Mhm. Mhm.
what could we what could we say or encourage, what are some of the solutions, because we also talking about the solutions in the management
Yeah.
for it. So
Mhm.
what are some of the solutions, especially for our African American, our culture? We don't want to, like, oh, you're trying to drug me up. that's the
Mhm.
that's the main
Mhm.
thing.
Mhm.
Majority of the time, some people do need the medication. Some people do need it, to keep them leveled on their baseline. And then some people, they just getting, not saying getting by, but they're just
Mhm.
maintaining. So
Mhm.
what would you
Mhm.
say
Mhm.
to people that have been prescribed medications, but they want to take it because of what our cousin and everybody else is
Mhm.
saying about
Mhm. Good question. Good question. So I will say I try to listen to definitely. I think what is important for us to do in our community is listen to our people. This is
it?
just even outside of psychiatry, right? We talk
Yes.
about pain. It's always been determined that African American women, for example, experience less pain, and it's not necessarily true. It's that oftentimes doctors don't listen to, or they feel somehow they're not addressing the needs of us. You know what I mean? When it
Mm-hmm.
comes to people who are on medications and they don't want to take the medication, I'll be honest, I don't, I really I try to listen to them and I try to respect that. What I pose is what else outside of the medicine is it that you're open to doing to further help this state that you're in, right? Because a lot of times we're not addressing these other avenues that we could be addressing that could be helping us to be more stable. So one of those things that I address is, are you in therapy? Are you open to therapy? Because
Yeah.
depending on the level of depression, therapy can be as effective as an antidepressant for someone who's dealing with mild to moderate depression. When it
Right.
comes to people who are on medication, I also want to know what is it that, what is this about? Why do you not want to be on the medicine? For some people they do say because I don't want to be looked at as being crazy, and
Yeah.
then so we have those conversations on, again, the stigma and outside entities kind of dictating what it is that we need that's best for ourselves in the moment, because I don't necessarily push that medicine has to be a lifelong thing, but maybe in this moment while you're strengthening these other aspects of yourself, strengthening how you are in your diet, strengthening how you are in just things you're engaging in that might be contributing to how you're feeling. Um, do you have people that you talk to, like, so for example a therapist, to be able to get things out, to process situations that may have happened in the past, to gain coping strategies? Are you strengthening these other areas? Because the antidepressant might be temporary, it might be, if you're willing to strengthen these other areas that you
Yeah.
have, you know what I mean? I also frequently want to know, are there some symptoms, there's some side effects maybe that you're experiencing from a particular antidepressant that's making you want to come off? Because if that's the case, then let's talk about it, because there are certain medications, people respond different, everyone responds differently. So for
Yeah.
one person where a medication might be great, another person may have side effects to that medicine, and there could be another medicine that might be more beneficial to them where they're not experiencing that.
Yeah. Yeah. I encourage, like, when the doctor prescribe, you got high blood pressure, you know, you're
Yeah,
not
are
gonna take
you
it.
are you willing are you willing to change your diet to, because if you're not willing to change your diet for the high blood pressure, then now you just have high blood pressure. And you do have
Right.
to, I mean, what are you willing to do all the way around to address it?
Absolutely. Yeah.
Because
Yeah.
ultimately if you don't address it, then we're talking about stroke. Now we're talking about all the other even more serious things that come from it. So same with depression, if you're not willing to address things outside, okay, then if medicine is working for you, or if you don't take the medicine and you don't deal with things, how is that impacting your overall health? It does show that a person that is depressed is less likely to take care of their other health. You know what I mean? They're less motivated to address their other health needs, and then that ends up being an overall demise to their overall health, because if they are dealing with diabetes or they are dealing with high blood pressure, the depression takes down the motivation and the drive to even have the energy to address
Yeah.
those things. So now we're talking about multiple issues that end up coming from that.
Yeah, absolutely. Someone said, Miss Connie, a lot of people are afraid of becoming addicted to the meds. Then what if that
hmm
happens?
Well, then I also try to give more education, because typically it depends on the medicine. I'm not big on prescribing benzodiazepines like Ativan and lorazepam. I don't
Yeah.
really go into the realm of stimulants, because I know those truly do have addictive qualities. And I want to know, outside of those particular medicines, what other medications can be managing symptoms without causing addiction. Antidepressants, in a general sense, they don't have addictive qualities to them. I will say any medication, this be it and psychotropic medications or any medicine, you want to talk to your doctor before abruptly stopping something, because
Yeah.
some medications, when you stop them abruptly, it's like the body has adjusted to something being there and it's no longer making its natural source of it. So when you stop it abruptly, you don't give the body time to adapt and start producing its own source of it. And so when you stop certain things abruptly, you can feel some really adverse reactions from that too. So, but in the general sense, when it comes to certain medications that are psychotropics, they're not all. Many of them, in fact, they're not addictive. There are a few classes of medications that are addictive, but when we talk about antidepressants, for example, they don't have any connection to being addictive per se, like where where people try to abuse them per se.
Yeah. Like tramadol and like what's this another one?
like
Norco.
like like
Pain.
Norco. Yeah, those
Yeah.
are really addictive. You know what I mean?
Yeah.
Yeah, those are addictive. Adderall can be
Yeah.
addictive. Lorazepam,
Hmm.
those are things that are addictive. Um, but um, but like sertraline or Zoloft, for example, it doesn't have any evidence that it shows any forms of addiction. But there are just certain medications that you do want to taper them off, just so that the body can get adjusted to being off of them. And when I say taper, it might be decreasing the dose for a week and then stopping. You know what I mean?
Yeah. Yeah. Definitely. You know what? I had a kidney infection. I'm telling all my little business. I had a kidney infection one time, and they was like, "We're gonna put you on Norcos." And in my head, so I had a patient that was
Mhm.
addicted to Norcos,
Mhm.
and it
Mhm.
scared like the lady was rolling on the floor. Like if I told it, like I
Wow.
tell stories and they don't believe me, I'd be like, "No, for real, this really happened." Like
Mhm.
in my
Mhm.
in my facility, then this lady rolled on the floor because she wanted her Norcos. And so when I heard Norco in my head, it was kind of like a trigger. I was like, I don't want any Norcos. Give me a Tylenol, 800, please. I can't. I mean, it's just a whole, a whole. It was a mess. But yeah, but people, I seen people that a
Mhm.
tramadol, Norcos, they get
Mhm.
addicted to, and on top
Yeah.
because they have majority of the people that have mental illnesses sometimes they have substance abuse because they want to cope with what's going on as far as with
Mhm.
the mental illness. They want to
Mhm.
drown out the voices. They want to stop the as far as like the pain and like self
Mhm.
mutilate. Like they cut
Mhm.
themselves, they feel like they're
Mhm.
relieving the pain. Like this stuff
Yeah.
is real, and I've seen it. I've seen it, and I just want to encourage people to to get in tune with themselves and educate yourself on different things. And if you do um have a mental illness, it's okay. It is okay
Mhm.
to have a mental illness, and I say that full force. It is okay. And that's why we have people such as our Miss Turner, and you have social workers, you have therapists. We're here to help you. So what I mean,
Yeah, and
like
I
I
will
just
say that education piece is really big because research does show that the more informed person with their health has better outcomes. So when it comes to medications, yeah, researching it, read up on it, understand what it's for, understand what the possible side effects are. Understanding why someone might be prescribing it. When you're seeing a provider, you don't. I think in our community, I'm going to say that we have the right to ask the people who are serving us, like the doctors, the psychiatrists, they are there to serve us. So that
yes,
means we get to ask them questions about what
yep,
they are saying they're prescribing. We get to ask those questions. Why are you prescribing this? What is this for? What can I expect? That's their
mhm,
job. That's my job. You know what I mean? To be able to serve the community and to be able to give them insight and to educate at the same time rather than just throwing something at them, give education around it.
absolutely, yeah. Because if you don't know, you like, oh, they
And
trying to give
there,
me.
yeah,
They need to know, and you know what? And
yeah.
in my job, I ask questions. Well, why are you giving them that? I try not to be
Mhm.
the doctor, but it's like, well, this person, and I said in a very nice way, like
Mhm.
this person is, hey, they're doing this. Maybe you need to check that out. Just get a little, give
Mhm.
you a little. This is what's going
Mhm.
on. Patient, I'm gonna write it down. Here you go. Slip you a little note. Because I care about the people, so I'm not gonna like allow you to, what I mean, like, because people like they think that, oh, you over medicating my loved one. And I'm like, but your loved one is spreading feces all over the wall, or they're having hallucinations, or they're hoarding clothes, or I mean, I could tell stories over and over, but this is the reason why they're on medication, because of the diagnosis, because of some of the behaviors that they have been displaying. And you don't want us to have medications, um and not to have medication. So what can we do? Like you just want us to Like, and I asked them that, and they be like, "Oh," I say they was doing it at home, right? And it was like, "Yeah, they was doing it." I was like, "Okay, so I mean, I'm not gonna tolerate that. They ain't gonna be beating up on me. So I'm just like, it got to be a solution. Someone saying, yes, my husband was given tramadol. It helped him tremendously. Doctors lessen doses gradually, but he never stopped it. Right, right, absolutely. Yeah, yeah, yeah. It works. It works. It works, especially like with people that have tremors. Um, uh, I'm trying to think of the medication as far as like with tremors, because
For the probably benztropine or cogentin.
okay. Okay,
Mm-hmm.
I knew a little sprinkle of it. I know a little sprinkle because I be paying attention because I want to know, like, what is this? Oh, okay, then.
Mm-hmm. Mm-hmm. Yeah,
Especially
yeah,
like,
the benztropine that's usually used for side effects with the antipsychotics, because that's where those tremors typically come from when the people are utilizing those certain antipsychotics. And so benztropine, also known as cogentin, oftentimes is used to kind of help mitigate some of that.
hey, listen here, I love it. I love it. I was like, people educate us. But no, and I'm so glad that you came and you're a part of Social Work Sunday Tea podcast. Do you have any last words or suggestions to the people? Just give some like encouragement or some advice to help them along the way.
Sure. I will say to be the biggest advocate for yourself, it's okay to learn more about yourself. I think when it comes to our person, especially our mental health, we can be the scientists of ourselves. And that means studying yourself to understand what's driving your emotions. It may take time, and sometimes it might hurt to even search for those things, but understanding that medication may be helpful for you, and that it is an individual choice, but I would say making a decision from an informed place. Oftentimes we're making decisions from stigma, and I would encourage to make a decision from an informed place. Ask yourself right now, are you going through an acute state of something where maybe you need some assistance? Um, and then what are the things that you think you can maybe explore in your own life and your own lifestyle that could be beneficial if you balance those things out more? Then would you see more balance in your mental health? Those would be my tips, but I would say not to allow the stigma of a thing to control um, your next steps. It's education that should be used first, and then make decisions from a truly informed place.
Yes, yes, thank you so much. I really, really appreciate it.
My
Like,
pleasure. My pleasure.
definitely. How can people find you? You have your own practice. You got a Mr. You dope. You know that. You like really, really dope. Like you got a lot of stuff, nurse practitioner, psychiatric. You got a lot of stuff. Listen, I'm gonna be calling you like, listen, they trying to get me to do this. But yeah, no, tell everybody, tell everybody, where they can find you. Look, I found Miss Turner through I think your cousin from Soul City when I was working doing the tea for Soul City, and she was like, "Hey, I got a cousin." I was like, "Okay, bring her information to me."
Oh, you're talking about my sister-in-law. She did
That's her
mention you.
sister.
She mentioned you
Okay,
to me. My
okay,
sister-in-law, and
sister-in-law.
I'm so glad. I'm so glad she connected me with you though, because I love your energy. I love
Thank
what you're
you.
doing. I love it. I absolutely love it.
Yes,
Um,
thank you.
but what I would say is, yeah, I have recently started a private practice in telehealth for psychiatry. Um, my goal in my mind is to help a person get the most benefit from their mental health with the least amount of medication. So medication is there, but not over medication per se, or the correct medications. Because a lot of times in our when in the areas I've worked in community health, a lot of us are dealing with trauma, and it's not being treated correctly, and it's not being addressed. So Inspire One Wellness, and you can find that at inspireonewellness.com, is my website for the private practice for telehealth. If you want to seek out services, I treat adult patients right now. I'm treating adult patients, and I do cash, but I do have several insurances that I accept right now as well. And then
Okay.
the other space that I work in, Mentally Magnificent, is a space where I really approach mental health from a holistic place. I do that because there are a lot of things that we just don't learn about who we are and ways to manage taking care of ourselves. And because of those areas are neglected, I think a lot of times we see it in our mental health. We see the outcomes in how we're managing in our day to day life. So that space is to really contemplate what we can be doing and be empowered, especially when we talk about lack of resources for so many of us.
Yes.
Um,
Yes.
that we don't, what in the meantime, what is it that we can be doing that maybe we have not been privy to understand how we can be more empowered to get to this better place in our mental health. So those are
Yeah.
my two areas. I do have a Facebook group for Mentally Magnificent called Mentally Magnificent, and then I have the Mentally Magnificent, Mentally underscore Magnificent on Instagram. Those are my two spaces.
I love it. I love it. Listen, everybody, y'all support Miss Turner. Like support her. Yes. I absolutely love it. And I listen, I'm so honored for you to get on. I know that you're out and about and you took time enough to, come on Social Work Sunday Tea. I'm forever grateful. And it's not gonna be the last time you be on the show because like we're family now, so we
Okay.
stuck together like glue. I'm like, hey Miss Turner, how you doing? I'm definitely that person. I am that person.
That's
So
fine. Bring it. Bring it. It's fine.
yes, every way I can support you, and I thank you for supporting me by being on this podcast. Great information. Oh, Miss Connie said, "Great information. Thank you." Yes,
Thank you,
this is what it's all
Connie.
about. Yes, we gotta enjoy. Okay, enjoy this topic. This is dear to my heart. Absolutely, absolutely.
Mm.
Yes, yes. Like I got my people. They know what I be doing as far as with mental health. Like I be like, hey, what you got going on? What you need? And connecting people with therapists, and it's the year. Like it's always the year of healing for me. And
Hmm.
connecting people, to heal from the inside out. So
Absolutely.
um, yeah, because once they heal, you can see things clear, and things will be open up. Like your eyes will be open to a lot of things.
Yes. That
And
you didn't
that's what
notice before. True.
absolutely, absolutely. But I'm not gonna hold you or talk you dry like my grandma would say. Don't talk you dry. All right, okay. Yes, but thank you
It's been a
everybody for
pleasure.
yes, absolutely. Thank you so much, everybody, for tuning in. I'm grateful. Everybody enjoy the rest of their Sunday. And I will see you on not next week. It's my mom's retirement party. My mom retired. Yeah. Hey
Oh,
mom. She retired.
congratulations.
I'm just trying to retire too. I just, I'd rather just do this, you know.
I
It's
hear
gonna happen.
you. It's
Yes. And
coming. It's
yes,
coming.
it is. It is. I'm just waiting on Auntie Oprah. That's it. And Uncle Reese, Tyler Perry, and all them. They see my podcast. I'm like, help me out. Just help me out. I'm gonna help the people. Help me out so I can help the people.
Right. Right.
But
That's
no,
funny.
thank you so much. And I'll see you guys on I think the 31st. July 31st, we'll have another podcast and make sure that you share I can't even talk now. Share, like, subscribe, all that good stuff. And it's for the people, it's for the culture. And you guys have a great and productive Sunday. Bye.
Thank you. Take care, Shakira. Take care.
All right, thank you.
Bye.